I'm Dave. I had stage 2 colon cancer, and one of the things that is certainly not troubling, but it's very difficult when you're diagnosed and after you have surgery and so on, is what kind of treatments do you have afterwards? And the very difficult thing, as I'm sure you'll find out, is that doctors, good doctors, will give you lots of possibilities that you can use for after treatment. The only problem is they won't tell you which one you should have, and they leave it up to you to make that decision. And so if you're not a doctor, if you don't know about these things, that becomes a very perplexing question. Now, my wife had breast cancer 4 months before I got colon cancer, and after she had her surgery, there was a test called an Oncotype DX test, which looked at the genetic makeup of the tumor and determined statistically if chemotherapy would be helpful. In her case, luckily, she got a very low score and didn't have to have chemotherapy, and it just, we didn't want to anyway, but this really fortified our decision and at least gave us some peace of mind to think that we'd made the right decision. Luckily, there was also an Oncotype DX test just developed a few months before my surgery, for colon cancer. And once I had the surgery and found out that the Oncotype DX test was available for the colon cancer, we had it done, found out that it was, thankfully, very much like my wife's outcome, was a very low score and helped me feel good about not taking chemotherapy as well. So these things are available. There's going to be a lot of questions afterwards about what you should do, shouldn't do, what tests do you want to take, what radiation, chemo, whatever do you want to use. And just one little piece here, the Oncotype DX test really did give us some peace of mind that we made the right decision, at least, or hopefully have. And I'm 2 months cancer, 2 months, I'm 2 years, thank you, cancer-free. And so far, everything, like I said, I'm just back to normal. So I think it was the right decision. And certainly, I'm glad that I didn't go through or didn't have to go through the chemo, because I've seen so many other people and talked to other people that did. And it's, the chemo was worse almost than the surgery and the outcome.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.